2 more minutes, we'll get started.
I got it.
Okay, it's 11 o'clock. I want to go ahead and get this meeting started. I want to welcome everybody to our employee compensation and benefits meeting on today, April 2nd, 2020. Would like to go ahead, and I know it's a little bit unusual, so please bear with us on how we're doing this. I'm sure we'll get through it. If we go ahead and get started, I'd just like to open us with a prayer. If I ask Commissioner Williams.
Turbulent season of anxiety and unknown, and we ask a double portion of your wisdom and guidance. We want to do what is absolutely the most enhanced way to help our employees, and will you guide us through this? We ask this in Christ's name. Amen.
Amen. Thank you, Commissioner Williams. At this time, I'd like to go ahead and just do a roll call of the commissioners here. Teresa, if you'd go ahead and do a roll call for us, please.
Commissioner Davenport.
Here.
Commissioner Ford.
Let's say it again, please.
Here.
Commissioner Light. Commissioner Light.
We can turn it off.
Commissioner McAllister.
Here.
Commissioner Williams.
I don't care if you leave it.
Here.
As long as they can hear us.
I have 4 present, 1 absent.
Okay, I know Commissioner Light was going to try to join us. I talked to him last night. He may be having some difficulty getting in. This is just a little bit different. I would like our county attorney, Allison, would you mind just kind of going over just a little bit of some guidelines and so forth, or how we do these meetings?
Just very briefly, you've had a roll call for attendance purposes. Any action that you take will be by a roll call vote today. This is being conducted further to the governor's executive order number 16, allowing electronic participation. And so I will leave it to the the chairman, as to raising hands and how you'd like to be acknowledged. But before you start, you will need the record to reflect that this is essential business of Washington County. So certainly the facts I would ask you to consider are the fact that this is to ensure that Washington County is addressing public health and safety guidelines of the CDC, complying with the governor's orders regarding the public health and safety, and certainly Mayor Grandy's executive order regarding the public health and safety in this county, as well as the statutory duties of the Director of Accounts and Budgets with respect to the payroll. There are a lot of duties and essential services here, and you may wish to take a vote on that or just acknowledge it, Mr. Chairman, if there's no objection or comment on the fact that this is essential business by the remainder of the committee members.
Thank you. To the committee members again, does everyone fully understand that? What you just said, we're discussing essential business here today?
Yes, I understand.
Commissioner Ford, Commissioner Williams?
Yes, I understand.
Commissioner Williams? And myself. Mr. Williams, you still with us? Did you hear?
I'm still with you.
Okay. And you understand this is just essential business we're conducting
Yes,
today according
I
to the governor's order?
understand it's essential.
All right, thank you. And I understand it as well. Okay. All right. So what we'd like to go ahead and do, part of the agenda is to review the minutes, but those minutes did not get out in time. So I think we're going to have to just bypass that at this time and go over the next meeting. They were just sent out just a few minutes ago. I don't think anybody's had a chance to review those. So I would like to go ahead and get to Miss Michelle Stewart, Miss Belva Hale, to go ahead and direct us on renewals.
Morning, everyone. What we have the two documents that Belva sent, and I will screen share those. We are presenting renewal that will begin July 2020 through June 30th, 2021. It is a great renewal from the prospect of, sorry, my phone's ringing. It's a great renewal. Our claims look good. We are proposing one change. So I'm going to share the screen of the financial document, and I'm going to ask Belva to go ahead and jump in and explain that.
Okay, I'd love to. Okay. Can everyone see the document?
Yes.
It's a little busy, I know, and next year's will not be quite as expanded. As Michelle said, your claims this year have run very well. You've had two areas where we've seen some increases, and we're definitely going to focus on one of them being specialty medications. So as we go forward for this upcoming year, we will definitely track that and make sure that we're following those costs. Are there ways that we can eliminate some of the costs? Are there ways we can mitigate those costs? And so that's one of the things that we'll be tracking very astutely this year. The other thing that we're going to talk about in a few minutes is your ER visits, and we're going to make a recommendation on that. But for this upcoming fiscal year, beginning July 1st, what we have put together is a recommendation of what we see all of your costs being. And we always look at your annualized fixed cost. That is your stop loss premium, your administration fee to actually administer your plan through Blue Cross Blue Shield, the PCORI fee, which has been renewed for 10 years, and it's a federal fee that the ACA does require payment. It's not a huge fee. But that has been reinstated. And then our consultant fee, which we also list as a part of the administration fees. Right now, I have put into place a 15% increase for your stop loss. That is, we feel pretty sure that it's not going to be a 15% increase at this point. But we always want to over budget to make sure that when you set your premium or we look at the premiums that you currently have in place, is it going to cover your total spend? So right now, it's reflected a 15% increase. We hope to have data back on that by Monday of next week, and we can finalize those numbers stronger, we can make sure that we have the actual data in place to bring back to you by the next meeting in May. The annual fee for Blue Cross Blue Shield has been submitted to us, and so we do know what that is, and that is reflected in this sheet as well. Okay, any questions on that?
Are there any questions from any of the Commissioner Williams, do you have any questions?
No, I don't have any questions.
Commissioner Davenport?
No,
Commissioner Ford?
I'm just fine.
Commissioner Light, did you join us? I don't know if Commissioner Light joined us or not. Okay, I saw someone join us. All right. Okay. No, go ahead, Belva or Michelle. Go ahead.
Okay.
We're good.
So the next part that we'll look at is the claims cost, and we've broken this down also so that we can make sure we're tracking everything individually. We have your medical claims, Any stop loss reimbursements that you would have received by this point, we would have listed there. Fortunately, you have not received any stop loss reimbursements at this point, but we do keep an eye on that on a monthly basis. The other thing we look at are pharmacy claims, and then your pharmacy rebate, and then your health center costs. The pharmacy rebates, we have tried to be very conservative on because we want to make sure that we don't overestimate what you might receive back from your pharmacy, actually the rebates from Blue Cross Blue Shield that you receive on a quarterly basis. What we've estimated in your medical claims and pharmacy claim increases are 10%. And even with coronavirus being what it is right now, should your claims keep on the same trend that they are, I still believe a 10% increase for this year will be okay, based on what we anticipate your stop loss to be. The health center, we have increased that cost based on the percentages recommended by Care Here. And so what you're seeing there is a 4.6% total increase, and that would include staffing, supplies, your labs, and medications. So that number did come from information that was provided by Care Here. For your dental and vision, the estimated dental premiums and your vision premiums, that information came from Blue Cross based on the number of your current participants. And then we did increase the claims information on dental just as a trending mechanism as we normally do. All of that together, you are seeing the total fixed cost in that column E on line 40 to be $6,463,818. What we've also looked at is your reserve policy and how you want to make sure that you have enough in a reserve so that if you have a really rough year, you have money set aside and you're not having to pull money from your general fund. You all have been very good with this. You've been very astute. You've been extremely responsible, fiscally responsible in putting this money aside. And so I commend you on that. There are a lot of our clients who are not in the same situation that you're in right now. So I commend you for that. So this year, there's an estimate of a beginning balance, reserve balance of $2,100,000 and a budget of $6,400,000. Obviously, these are somewhat rounded, but I still believe that they're good, solid, conservative numbers. We believe that for right now, you've gotten $383,492 in pharmacy rebates. We've taken all of that into consideration, and the end of the year, we believe your reserve will be $3.1 million, right at it. Carrying that forward to next year, and again, looking at a budget that is 6.4, which is $6,400,000, which again is a little bit of an estimate. Looking at your pharmacy rebates of $200,000, we're looking at a little bit of an excess of $136,000 that will go back to your reserve. From a reserve policy perspective, I think what has been recommended and has been approved is a 6-month reserve. It appears right now, if you make no changes to your pharmacy sheet, if you make no changes to your premium, you should be able to still maintain your current premium levels, even with the increases we've anticipated, and still have your 6 months of reserve at the end of next year. Are there any questions on that? I know it's a lot to cover quickly.
And I'll go through the roll again. Commissioner Williams, any questions? Commissioner Davenport?
No, I don't have any questions.
Mr. Ford?
Not at this time.
Okay. All right, Belva, continue, please, if anything.
Okay. If there's no questions with that, then what we're going to talk about right now is the one recommendation we do have is a change to your plan design. Your ER visits are consistently increasing year over year, and the visits themselves aren't all true emergency visits. An emergency visit will run on average for this past year about $686. That's a lot for a visit that could have been handled through your health center or through a primary care physician. So what we're recommending this year is that you increase your copay for the ER from $250 to $500. Now, that's a huge jump, and I recognize that fact. But the other part of that is if you are admitted to the hospital, that's waived. So if you have someone who goes to the ER and it is a true emergency, they are treated, they are admitted, then that copay goes away and your other plan design kicks in. Whatever that deductible and their coinsurance is, all of that now applies, and that copay is no longer an issue for the employee. The primary reason I think that we're making this recommendation is it's been a trend we're seeing over the past 3 years, and you're not the only group that has this problem. But you do have a health center, and some other groups that I work with don't have that option. And so I think sometimes people are using the emergency room as their primary care because they don't have a whole lot of options. You all have provided this wonderful center for your employees. And so I really do believe that deterring those visits can be a key, not only for your employees, because it'll help them go seek treatment at the right place. And then if they do have an emergency, you absolutely want them to go to the ER. If they think they're having a stroke, they think they're having a heart attack, they still have the ability to go. They will be treated. They will be taken care of. And they also will have the ability to put monies aside in their flexible spending account. So I feel like this is a move that could potentially, this past year, just from the copay, could have saved the plan $50,000, which is nothing to take lightly. So again, it's a big shift. I'm not denying that. But I do believe that it will help folks recognize the fact that this is a very expensive proposition when you go to the ER because you have an earache or you have a cold. Rather than, and especially now, we do not want people at the hospital if they don't need to be there, because we all know, kind of what's going on at our hospitals, and they don't want your employees there if it's not an emergency. And their employees really don't want themselves or their children there if it's not an emergency. So I'll take any questions on that. If anyone has any, or Michelle, if I need to make any other comments, please let me know.
Gary, do you have any questions?
Well, I have a question.
Go ahead, Commissioner Ford.
What is this based on actual figures or estimated?
Yes, sir.
How did you come up with that figure?
Came up with the figure from your current number of ER visits. No, I'm telling you that wrong. From your last calendar year number of ER visits, there were well over 200 visits. And almost half of those visits, based on the diagnosis, could have occurred. They could have gone somewhere else for treatment, sir. So it's just, we feel like it's a trend that is just continuing, and we feel like it needs to be addressed.
Thank you.
I guess my concern is that's a big jump, 250 to 500.
Yes, sir.
Could we do it in increments? I mean, 350, what would be the difference? What would be your thoughts on?
I think anything that you can do to kind of deter folks from taking that action, if it's not necessary, I think you can do it at 350. I think that's fine.
One thing, let me clarify. The wellness plan has a $250 ER copay. The non-wellness plan has a $350. Employees do have access to telemedicine free of charge 24 hours a day through Care Here. They also have the access through the clinic when the clinic hours are open. If we're going to go to a different level, we need to differentiate if it's for both plans or a flat, like what we're proposing is $500 for both plans for the ER copay.
Thank you, Michelle. Sorry.
It's okay. No worries.
Commissioner Davenport, Commissioner Davenport, you have any?
Yes. So if someone would their child or themselves would get cut that require stitches, that's an emergency room call that not going to stay overnight. Then that's a true increase of $250, right? I mean, just to blanket this at double seems to be a tremendous burden that I don't know that we should take on, that our employees should take on at this time.
It would be double for those in the wellness plan. It would be $150 more for those in the non-wellness. We could do 400. We can move that number. The goal is we've steadily saw those costs increase in ER visits, and when you look at the diagnosis, a lot of those are non-ER visit items. A lot of health plans do ER visits toward deductible. We do not, because then that would be an even greater expense to employees, because they would be responsible for their deductible up front. So we are open to, if the committee doesn't want to change it, if they do want to change it, we just feel like the numbers are rising quite a bit, and we have people that are treating there that are non-emergency type diagnosis, and then that's costing the health plan quite a bit more money.
Yeah, I understand that, and but again, I think we could possibly try to address that a different way in just educating and letting everyone know about this cost and what it's doing. And if this cost increases, does not decrease, then we'd have to move to such a plan as $500. But just to move it, I have some concerns with that myself. I understand we don't want people going to the emergency room. We want them going to the other facilities that are open. But at the same time, just to throw this out there, not something I think I would be willing to do.
That is totally your call. And if you want to make a motion to accept renewal with the cost that Belvis presented, with what we anticipate, we are not making any other changes to the health plan. We're not recommending any other changes. We're also not recommending any premium increase. The ER copay change would have been effective January the 1st, and it would have been both plans having the same ER copay. But of course, you can make a recommendation of whatever you want. That was just based on us looking at numbers and trying to figure out a way to control cost with minimal disruption to all employees.
And I appreciate that, and really appreciate you identifying the extra cost. That's something that needs to be brought to our attention, and great work of really getting into the weeds and getting into the details of our plan and our benefits to the county employees. So great job there. But that's just my stance. Anybody else?
I have a question.
Okay.
I don't know what the visits are that are, I think education to the employees is a big issue, knowing what is an emergency or what is not. But I think that would be one benefit to our employees especially. But if someone goes to a clinic and then referred to the emergency room and they don't stay the night, is that not an emergency?
Well, it would be. They would have their ER copay. So let's say, for example, they go to the urgent care center. They go to First Assist. They are referred there. First Assist can handle a lot of basic things, but if it's life or limb threatening, they're going to refer them over to the ER. So there would be that ER copay at that point. I do educate the employees when we do enrollment meetings on ER cost. There's also in the employee benefit guide on page 3 for the ways that they can control their cost and control county cost. One of those items is limit your ER visits, and we list each of the other options available to them. So we are already promoting and educating people on the use of ER facilities. I would continue to do that. I just don't know what else more I could do to educate them. But they do have access to urgent cares first, but then if urgent care refers them, then they would have their ER copay.
Well, I'm not implying we're not educating, but sometimes it's just better if they have examples of what's emergency and what's not.
Well, in addition to that, can I say something?
Go ahead, Commissioner Williams.
I have felt that if we had addresses, telephone numbers of all walk-in clinics, urgent cares, however you label them, that they could use. I believe, Michelle, I talked to you about that. Has a list been prepared for our regional places?
Yes. We advise people, to always check the Blue Cross website for urgent care centers. I run that list for anybody that comes to me that needs that. We don't particularly list the actual sites and phone numbers in our benefit guide because I don't want us to look like we're recommending a certain facility for care. And some urgent cares come and go, like one may be added. I'm a little hesitant to actually list the names of urgent cares because then it looks like Washington County is endorsing or recommending employees go to that one facility. So we have said urgent care facilities that are in network are your copay and educated employees in that way, but I've not actually done a list because of those concerns.
Well, they may be valid, Michelle. However, if a child or somebody falls and breaks an arm or whatever, you don't want to take the time to have to go sit in front of a computer or a laptop and find out where to go. And sometimes some things can even be handled in urgent care if it's simple. I guess that's why I was wondering if we could help them know their first choice, not recommending, but where they are, the operating hours, etc.
Sure.
I can certainly work to put something like that together. My only concern is from knowing the employee population. They get a benefit guide each year. Most of them don't keep up with that. So I'm a little hesitant to think maybe they would keep up with a list or anything like that. I can certainly prepare something and email out to employees or stick a page in the employee benefits guide. We could do both of those things.
Well, what I brought you was an example of a credit card size info, and I would think not a paper list or computer list, but something they could stick in their billfold, or, their families could have something in their cars would be ideal.
Chairman?
Okay. Commissioner Ford?
Yes, I agree completely with Mr. Davenport because I think it's just too big a pill for employees to have to swallow, especially these trying times. I can't support that today. I just want to make it known my feeling.
Okay. I know there's some other questions. Hold on. I'm going to Commissioner Davenport, Commissioner Williams, Commissioner Ford. Do y'all have any other questions?
Well, I guess just a question. The $250 that you pay at the emergency room now is quite a bit different than the copay that you would pay at one of the other healthcare facilities. Is that right?
Yes.
So how much is a copay at urgent care?
Yes, an urgent care. An in-network copay at an urgent care is $35 for the wellness plan, $60 non-wellness.
So it's quite a bit of difference to choose the emergency room. So they're choosing the emergency room for what they think is an emergency. So I'm not sure that $500 would deter that if 250 is not. So that's all I have.
Anything else from the committee members? Because I've have some other people have some questions. I'm going to open it up. Yes. All right. Commissioner Jones, you had a question?
I just thought I'd weigh in a little bit since I work in healthcare, and I can certainly relate to the concerns you're hearing today from Belva and Michelle. The problem of patients going to the emergency room is a problem everywhere, and not just in this health system, but in all health systems. And it's been something we've been battling in primary care for a few years. It's very costly to our healthcare system and something that we just have had a hard time problem solving. I'm not suggesting that the answer is to raise the fee here, and I just wanted to give the committee something else to think about. First of all, the universe reinforces this pathway. If you look, there's billboards that tell you it's only 5-minute wait at the emergency room. So people who are not feeling so great, it's just really easy to swing by and run in, and as opposed to having to make an appointment or wait longer for to see a doctor. And I know our particular clinic is extremely fast and helpful, but sometimes for patients, it seems like the emergency room is quicker. And the concern is that emergency care isn't as good as seeing the doctor that knows you best in your regularly scheduled clinic. So, we get poorer health outcomes when people go to the emergency room, particularly for the reasons that Belva and Michelle are discussing with you today, reasons that are not great. People who overuse the emergency room. Now, people who use the emergency room appropriately for emergencies are not who we're talking about here. People who overuse the emergency room fall into two categories. One are people who have simple problems like colds and earaches and weird feelings that they just don't want to wait and see their doctor for, and it's just kind of a bad habit. And then the other group are people with complex health and social health needs who are struggling with mental health issues, resources, and other kinds of things that sort of drive them to make just a not great decision in terms of where to get their care. And some things that we've done in our primary care clinics have been just to reach out individually to patients who make those choices. And I know those big giant packets that people get about their benefits are hard to read and lose them after a while, and you don't look back on them. And I don't disagree with like a little pocket card or some other things. But I just wondered, one question might be whether you all are reaching out to patients who misuse the ER and just kind of do some individualized education, welcoming them into the clinic. Those are some efforts we've made that have been somewhat helpful in expanding care for some of our patients that have specific social health and really complicated health needs. Just want to let you all know that issue and some of those facts that I happen to be a little bit versed on.
I think we could certainly ask the health center to reach out to everyone to just kind of let them know the ease of being able to make an appointment, exactly what you said, and that is we get to know you, we get to know your family, we make sure we treat you appropriately. If there's anything that we're finding that's a chronic condition, we need to make sure that we're following up on that as well. I think Blue Cross could potentially reach out to all those who have gone to the emergency room. But we're struggling a little bit to be able to actually reach out to just those we feel like have a diagnosis that may not have been an emergency, because we certainly don't want to appear to be discriminatory in that action. But I do think we could have, the ability to reach out to all employees just to verify once again the ease of the health center, the ease of being able to get access to that care. I think that's absolutely something that Michelle and I can discuss. And I think that's a great point.
particularly right after they've been to the ER, and calling them and just letting them say, like, oh, I just saw that you were at the ER. Are you okay? Your primary healthcare cares about you. We'd love to see you next time if you have the same problem, or what can we do to follow up with?
Okay.
Michelle, Velvet, what else do you have for us?
That is it on renewal. Again, we were presenting the increase for the ER copay, which you can take that off the table if you choose to. But the plan would renew with no additional premiums from the employee, with the estimated cost for dental, vision, prescription, medical, and then the Care Here clinic. So this would be the third year that county employees would have no increase in premium. 2 years ago, their premium decreased. Last year, their premium stayed the same. This renewal would be a stay the same on the premium. So that's good news. Most employers are not able to deliver that. So I am really proud of the work that we've done. I'm proud of the employees for making good decisions. We've just identified one area where there's an added expense. But our people are using the clinic. They're using their health plan wisely. So I want to say a shout out to employees for doing that, because it's obvious when you look at our numbers. Our numbers are amazing, honestly, for a group of our demographics, and the large number that we have, that we're able to, again, once a year say, employees, your premium is the same, and we are building the reserve fund. Your benefits are the same, or maybe one small change. I think that's phenomenal.
Agreed.
Thank you for all your hard work. Y'all done a very good job there. Okay. All right. From the committee, they present the information to us. Is there a motion on the floor at this time from the committee member?
I just want to say one more thing, Gary.
Go ahead, Mr. Williams. Go ahead.
I just really feel at this time there should be no financial to our employees, because there's such uncertainty of what's going to happen financially.
Okay.
I agree. And with that said, I would make a motion that we accept the renewal without the emergency room increase to our employees. That would be my motion.
Okay, we have a motion on the table. Is there a second?
Second.
Second for Commissioner Ford. All right. Any further discussion at this time? Let's see. I think everybody's raised. See if there's no discussion at this time. Teresa, could you do a roll call, please? Teresa, you still there?
She is, but she needs to unmute herself.
Okay.
Commissioner Davenport,
Yes.
Commissioner Ford,
Yes.
Commissioner McAllister,
Yes.
Commissioner Williams,
Yes.
4 yes, 1 absent.
Okay, the motion passes. That will be forwarded on to the budget committee from here. So thank you. Thank you, Michelle and Bell, for all you've done, for all your hard work, and appreciate it very, very much.
Thank you very much.
Thank
Okay.
you.
All right.
Thank you, Belva.
Thank you. Bye-bye.
Bye.
Next on our agenda is an area we've been working on for several months here, is the workman's comp that we have talked about and before has been brought to this committee. I just want to ask some input from, we've discussed that, and this may be just a little, I really want to bring this up just, and I want to ask our county attorney here, because I know this is supposed to be just essential things to our county at this time, but this has been discussed for a long time, and want to keep on moving forward with this issue that we've been discussing. And since we have several office holders here, but I don't know if this has been put on the back burner, and feel how the committee would like to move forward at this time. So, Allison, is it appropriate to go ahead and address this issue at this time? Allison, I can't hear you.
And is it not?
I can hear you now. Yes.
Thank you. Is this item on your agenda?
It is on the agenda. Yes, it is.
And did you need to review any documents that haven't been previously circulated?
No.
I think those are the two inquiries. And then, but if you have any concerns, you just would want to have a determination by your committee of how that is essential business. I'm sure that your committee members would weigh on that from their own experience over these past few months of addressing that issue. And it may very well, impact the budget and other considerations. And that's, the governor has made very clear, is essential to the county business.
Okay.
Mr. Chairman,
Yes, Mr. Commissioner Ford.
I don't really feel comfortable in moving forward with this today, and I'll tell you the reason why. We have an extraordinary amount and number of employees wanting to be a part of this, and we're not making it available to them. There's no way that a lot of people that have input can be available to do it. And we talked earlier, and I didn't know this was going to be on the agenda until today.
Okay. Commissioner Davenport, your thoughts?
Just a question. If we don't handle this today, making a decision next month or the next month, how would that affect our ability to make the change?
Michelle, I may have to address
budget reasons and things like that.
At the last meeting, we discussed making sure that the elected officials knew what was before you and what possible changes there could be. I was going to ask them at the first COVID-19 meeting that we had at the EMA office, but there were people there outside of the county. So I followed up with an email that each of you got to all the elected officials, telling them what was before the committee, the options that were presented last meeting. When we talked about those, I had suggested making any changes effective with plan renewal for workers' comp, which would be a July 1st start date. Of course, you could make a change and set it at any time, but we had talked about making it correspond with the insurance renewal for workers' comp coverage, which is 7/1. So if you want to look at it for a 7/1 start date, you could put it off and do it next month. You could even do it in June for the county commission to look at it in June for a July 1st start date. I guess it really depends on the wishes of the committee of, do they want to do something middle of the year in the workers' comp plan contract and of the year that we're counting those claims, or do you want to change it when the plan renews?
Commissioner Davenport, did I answer your question?
Yes, it did. Thank you.
Mr. Williams, go ahead, please.
I think this is a subject that's kind of difficult to get a feel for electronically. I would like to see if we are able to have an assembled meeting in late April or May and really go over it where people that are going to be affected can be there.
Okay.
Mr. Chairman?
Yes, Commissioner Ford.
If you would so entertain a motion, I'd like to make a motion that we table this until we until the time that we can have an assembled meeting where people can see each other face to face that it pertains to, and then make a decision.
Okay, that's Commissioner Ford's made a motion to table this time. Is there a second for that?
I second it.
Commissioner Williams, second it. Further discussion?
I guess the only question, I'm okay with deferring it. I think it's the right thing to do, but I would like to do this before we get into budgeting. And so it may have to be brought up in this manner in the next couple of months. I mean, if someone knows when this thing's going to end, we'd all like to know.
Okay, that's a good point. Any further discussion? Okay, there's a motion on the table there's a motion now to defer this to hopefully our next meeting. Teresa, could you go ahead and please do a roll call, please?
Yes. Commissioner Davenport,
Yes.
Commissioner Ford,
Yes.
Commissioner McAllister,
Yes.
Commissioner Williams,
Yes.
4 yes, 1 absent.
Okay. Motion passes. We'll defer this to hopefully our next meeting that hopefully will be in person here. We'll meet. Okay. Our next on our agenda, and is the amendment to our Washington County Basin Personnel Policy Employee Handbook. And this time I'm going to ask Michelle and Allison, our county attorney, if they would kind of lead us in our discussion of this topic, please. So Allison, Michelle, I'm going to turn it over to you.
I always defer to Michelle Stewart to
Okay.
explain the nuances, but I would like to give everyone a background because much of it came out of very fluid circumstances as the county addressed what was being presented by employees and by office holders and department heads. Just for background, the mayor sent a few communications out, and this addendum has been drafted in conjunction with Michelle Stewart having been designated the COVID-19 coordinator. It's really the intent of this addendum to reflect the circumstances that have been presented to the office holders and department heads and employees. So I think it's a great opportunity for y'all to weigh in if that's what it's doing for you. This shouldn't be anything new from what you've been dealing with, but I'm very open to making sure that you who have not been reading and thinking about this for 2 weeks, feel very comfortable letting us know if you see a gap in anything that would help you administer it. It has been created with the input of the Director of Accounts and Budgets to ensure that when he verifies payroll, that there's accuracy in the record keeping to reflect who was at work so that everyone's benefits are held in place throughout this pandemic, and also that individuals are comfortable not making a choice between, their personal safety or the safety of the community, that the county employees can conform to the governor and executive orders. But I think Michelle will be your contact in administering this if the commission puts it in place. So you really want to hear from her because she will be the person working with you to make sure that what is handed over to payroll accurately reflects the facts that have been presented. Thank you for asking. Here comes the train.
Okay. Michelle, we'll leave to you.
Okay. Each of you have a copy of the policy. Basically, the policy is broken down into the 2 federal leave policies, the 2 employer-determined policies, and then an employee requested policy. So I'm just going to take them each and just go over them very briefly. The 2 federal leave policies are in response to the Families First Coronavirus Response Act. One of them is an Emergency Paid Sick Leave Act that gives up to 80 hours to employees that have one of 6 qualifiers. There are 3 qualifiers that gives the employee 100% of their pay under that, and then there are 3 qualifiers that 85% or 2/3%. I will tell you that is something we have to administer. We already have 3 employees that are on emergency paid sick leave under that Families First Coronavirus Response Act. The second layer of that is an expanded Family Medical Leave Act that continues to give employees family medical leave protection for one of those qualifying events. It has been communicated out to employees, that piece of the policy, because again, that's federal law and we have to follow that. So we have our notices up, employees have been advised, and we do have 3 employees that are currently have made the request, have been approved, and are ready to take that leave effective yesterday. The second part of the plan is the employer determined. The employer determined are telework, and then also the authorized to stay at home. Both of those policies are currently in place in some offices. but we don't have a written policy for it. So we need to address that. The temporary telework policy that you have has a defined purpose, provision, and consideration. It outlines what the employee's responsibilities are to telework, but also what the county's responsibilities are to ensure that they are doing county business, they have the right equipment, how long that will last, that sort of thing. And you do have the, in your handouts with the addendum, you do have the form for that that would be used for that, that the employer, the department head would define the job task, all of the criteria that comes into play. So we do need a telework policy if employees are going to be allowed to telework during the pandemic. Any questions so far on those on telework, or if you've looked at the policy?
Yeah, I'll open up questions to the committee members. Any committee members?
I don't have any questions.
Mr. Ford? Commissioner Williams at this time?
No question.
Okay. And I know we have a number of office holders. What I would like to do this discussion that are on here, and I thank you for being here. If we can just kind of let Michelle go through this and hold your questions, and we'll open up the floor for questions for everyone on this. Okay, go ahead, Michelle.
The next piece of employer determined is the authorization to stay home. That is occurring in some offices that need to lessen their chance of employees interacting with other employees. For example, we have some offices that have large numbers of staff members that work very closely together. Their desks are assembled where they can't get away from each other in 6 feet increments. There are more than 10 people in that workspace. So the authorized to stay home policy is the second employer determined. Those are individuals that their job assignment for that day is to be sent home to be quarantined. For example, an office holder may have half the staff working Monday, Wednesday, Friday this week, with the other half the staff off those 3 days. And then the next week, some staff work 2 days, some staff work 3. But that is to help minimize the risk of exposure, and then also to keep the office within those CDC guidelines. Some offices have had some decreased workloads, so they feel like it's better to get employees out of the work site for a few days a week. So that is the authorization to stay home. The employee requested is the other option. That would be employees that are requesting to self-isolate. Those are employees that have risk according to the CDC guidelines, which are over 65 and certain health conditions. I've been advised that the health conditions have been updated since the form was created. So the policy reads that it's based on federal and state officials. So we would look at CDC guidelines at the time the employee makes the request. But base isolation is those employees that have a higher risk for severe illness, that feel that it's important for their health, that they self-isolate. So they would not be at work. They would not simply be off based on their increased risk until the pandemic is concluded. In your packet, you do have all the forms that we would use.
Michelle, we just lost you. Michelle, you just got muted.
I think I'm having computer issues.
Okay.
Am I back now?
You're back now.
Okay. I think our internet is coming and going. I apologize for that. On the forms that are attached to the policy to the addendum, you do have the Department of Labor notice that we have posted and shared, the emergency paid sick leave form, the request for expanded family medical leave, the telework request and agreement, and then the self-isolation form. Those forms would be completed by the employee, returned to me to make sure they qualify, and then at that point, payroll and the elected official would receive a copy of their approved form back. The goal is that we all funnel people to me to make sure that they are qualified for whatever portion of leave they have, so that we can make sure we meet federal law, but then also any personnel policies that the county adopts. So I hope that I explained all the pieces well, but they are three parts. One, the federal law, one, the employer determined, and then the employee requested are the three parts of the policy.
Thank you, Michelle. And again, how I'd like to do this, first I'm going to open this to commissioners, then I'll open it up to the office holders here in just a minute. But committee members, Commissioner Ford, have anything? Commissioner Davenport?
No, I don't have any questions. I'd like to hear what our different department heads had to say.
Okay. Commissioner Williams?
Have any questions?
Okay. Commissioner Jones, you're online here. Anything, questions you may have?
Nope, I'm good.
Okay, I'm going to just kind of go around the room here. I see I got the Sheriff's Department up here. Rick, in your room, what are your thoughts, comments? I can barely hear you. You're still on mute. Rick, do y'all have any? Okay.
Hey, Commissioner, it's Lita.
Okay.
I don't think we have any questions, do we? I think we're good with
Okay.
Farms
Right.
and work that they've done to help us with this.
Okay. Mr. Mayor, I've got you next. Do you have any comments?
Okay, there we go. Only to say that this is, one of those things that's really important to try to capture the cost related to this COVID-19 in the event that we are able to recover the cost in the future. Based on the national declaration in FEMA. So thank you for all the hard work in putting these tracking forms together and helping us get this organized as we move forward to try to protect our associates and employees. Appreciate you very much.
Okay. Mr. Deakins?
No, I don't have any questions. I just, yes, I do have one. We started our offered schedule 2 weeks ago, so we've already entered the payroll according to the new payroll designations for the COVID-19. So before the meeting, I talked to the county attorney, Allison, but I was going to ask if it was retroactive, but by doing the payroll, that answered my question, I guess.
Basically, what people are doing now is the policy per se. And if Gary would like me to, I can give him a list of what each department is doing now. That basically anything that's being done right now is consistent with the policy. There's nothing really different, except we are not doing self-isolation as of now, as employees are being paid to self-isolate. That would be the only new thing that we're not doing. But I will be glad, Commissioner McAllister, to give you a list of departments that have made changes and what's going on, if that would help.
Okay. Why don't you just go ahead, Michelle, and if you want to take a few quickly, if you want to go ahead and do that, that's fine.
Okay. Circuit Court began on last week, 3/23. With alternating their schedules. So they have been doing the employer determined. The Highway Department is also doing employer determined with altered work schedules. The Register of Deeds office started this week, the 30th. Half of their staff is working 1 week. The other half is working the next week. Agriculture, the one employee that we have there at the Ag Extension office, began working at home on 3/23. Purchasing has 2 employees that are working 2.5 days a week in the office, and then they are out of the office the other 2 days. They are not teleworking. They are just being paid to stay home. The assessor's office started this week, 3:30. doing a split of employees. Half the staff is there each day. The library has 4 employees that are teleworking. Their other staff is in the office cleaning, disinfecting, doing projects, that sort of thing. We do have 1 employee that has requested a leave of absence. We have another employee that is using their sick leave because they have a chronic condition. That employee would fall under the self-isolation, as would the one that's the leave of absence. Again, as of today, we have 3 employees that are on the emergency paid sick leave of 80 hours under the federal government guidelines. And I have 1 employee that has just requested that. So there's a possibility of 4 by this afternoon. But again, everything that is happening now in departments and within county government is meeting the policy before you, except we don't have teleworking agreements in place. And then we are not doing the self-isolation at this time. We're waiting on that piece to be approved by the commission as well.
Okay. Mr. Dickens, did you have anything else?
No, that's all I have.
Okay. I got Rusty Sales. Mr. Sales, do you have any questions? I can't hear you. I'm sorry.
No question.
I
Okay.
don't have any questions.
Thank you. All right. Let's see. Mr. Story, Rick Story, I've got you down here.
No, I don't have any. I just appreciate consideration on the policy, because right now we have everyone in place, and we do need to segregate some of our folks, because with just a small staff, if something should spread through the office, and you take the whole office out. So right now we're just keeping our distance, but we appreciate the consideration of that policy.
Okay. I have someone on here. I'm not sure who this is. Tim, I'm not sure who you are. I'm not sure who.
That is our videographer who is live.
Oh, okay. Thanks. I'm sorry. Okay, Tim. Glad you're here. All right. Brenda, Miss Downs. Brenda, you still on the phone? Brenda, you still on the phone?
Yes. Can you hear me?
Yes, I can hear you now.
Okay. No, I don't have any questions, Gary. Thank you very much.
Okay. I think I got everybody. Sherry, was there anything else? Sherry, you're on the phone? I think we're good. Okay. All right. Going back to the committee members. Commissioner Ford, Commissioner Davenport, Commissioner Williams, do you have any other questions?
I
Go ahead, Commissioner Williams.
don't have any questions.
Commissioner Davenport?
Just a statement. I'd like to thank all of our departments for thinking outside of the box and taking care of the workers and taking care of our offices. Great job in not letting a bunch of red tape delay your decisions. Great to move forward, and thank you all for your leadership.
Commissioner Ford?
I have no question.
Okay. Yeah, I just want to echo what all the commissioners are saying. Thank you for all you do, for all the county employees, especially. I know that Commissioner Ford and I have talked about the sheriff's departments. You guys are the first line of defense out there, and if something happens, if that virus gets there, it can be tough. So thank you for everybody, what you do, and for all the officers and office holders and everybody. Is there a motion on the floor to accept this amendment to our Washington County-based personnel policy?
This is Lita with the Sheriff's Office. I have a legal question, please.
Okay, sure.
I guess for Allison. Allison, can I deny this FMLA for an essential employee? I mean,
FMLA, that we must follow the federal law for that. So if an employee qualifies for FMLA or extended FMLA, we the county, and that would include the sheriff's office, have no discretion in that under the law. So Michelle, how would you typically administer that procedurally?
Key employees can be excluded for family medical leave. I don't administer the sheriff's department's FMLA, but speaking from a county perspective of all the other offices that I manage, we have never denied family medical leave to a key employee because we feel like there's a need for that employee to not be at work, and us as an employer should try to accommodate that to the best we can. So we have never denied a case, but you may have that come up. I would defer back before you chose to deny an essential employee. Let's make sure they're defined as essential, and they meet the normal FMLA guidelines. The expanded family medical leave guidelines are basically an extension of that emergency paid leave, sick leave, for employees that do not have child care. They've never been able to qualify for FMLA for child care needs, but under the COVID Response Act, that is a qualifying event.
Right, that's my concern, Michelle. The majority of my detention officers and our patrolmen have no child care right now for their children. So when this policy goes out and they all see that they can ask for leave, I'm not going to have enough people to work.
The COVID Response Act does have an exemption for employers or employees who have health care providers and emergency responders. So there is an exclusion for those.
We can deny.
If I may go back to the very beginning, I hope this will help you, Chief, that all of this, and to some of the commissioner points, is that we're trying to ensure that we document the steps that we're taking to protect the health and safety of the employees while maintaining what we have to do under labor law, whether it's state or federal, and then certainly for record keeping so that FEMA recovery can be addressed. So always, I think the circumstances will dictate, and touching on what Michelle said, there are those exclusions available, but it would be important if you're administering that you step through it step by step on those exclusions. I'd be happy to work with you. I'm sure Michelle would if you need help on that, to make sure that you've complied with the federal law and substantiated any exclusion or exception that you find applicable for your department.
Hey, Rusty, would you mind reaching out to the Sheriff's Department after this call and just letting them in on some of the child care that's been set up specifically for first responders and that sort of thing?
Yes, sir. I was actually I'm on the phone that I need to use to text Lita, so I can get in touch with her as soon as this is over with.
Thank you very much.
And Rusty has told me of some of the plans to set up, daycare for first responders. I guess another question I have, and I'm sorry to be the one with so many questions. The question I have is, what if people don't want to leave their children with those people that they don't know?
Well, I think the fact that it's available, may change the situation just a little bit. But I think on that, we probably have to look at it on an individual case-by-case basis. The fact that this childcare exists is really important, and it's important for all of our first responders. You guys do such a fantastic job every day. That was one of the first things that we tried to put in place. Thank you.
And just one more comment, and then I think I'm done. Is there going to be any consideration for some type of hazard pay for those employees that I can't send home? I mean, these people who can self-isolate are going to be home getting paid their full pay the entire time. And I'm going to have a huge majority of our people who can't take off at all and are at risk.
Yeah, that's a great question. And I'll just say that that is certainly under consideration, and we're going to try to work something out. It'll probably be after this pandemic is past us. Right now, we're just sort of in the throngs of trying to be tactical about things that are going on and try to get the work done, as I know you all do every day. But that is certainly a consideration that we'd like to have the commission work on, pretty soon.
Chief, any other questions?
No, I understand, what we're all dealing with, but I've already had employees, talking about how it's, and I hate the term, it's not fair when we're dealing with a national emergency, or worldwide emergency, but I mean, there's no incentive for these.
I think that's something to be further discussed too.
It concerns me.
Yes.
That if we, after this is over, it'll be too late.
Okay.
Thank you.
Okay. Is there a
Could
motion?
Excuse me.
Commissioner Williams, go ahead.
Could we get what other counties are doing for your essential people, Lita?
Ma'am, I'm sorry. What was the question?
I would like to know what other counties are doing to incentivize the people to keep working that are essential.
I don't know what other counties are doing. I know that Ballad Health is paying premium pay for essential workers right now.
Okay. Thank you. I thought I'd read that.
Thank you.
Okay. Thank you. Allison, go ahead.
Thank you. 2 points. I wanted to let you all know that's consistent with what Commissioner Williams just brought up. Chairman Matherly has raised that issue and has asked me to do some research on compensating frontline responders, essential personnel, people who didn't take any time away, etc. Commissioner Harris had raised the issue in another meeting. So that review is underway. I am working on finding some comparables. Mayor Grandy had asked for that as well. I recommend that the documentation, that I'll just add a line that says supplemental forms and documents may be made available. Likewise, another question was if Michelle could walk through a scenario that might be helpful. Is there a limit on number 3 was the question that came to me. If someone self-isolates, and I think this touches on the it's not fair type of scenario, is there a limit to the time that someone could self-isolate? And what would happen if somebody was, if you're out on emergency paid leave, that's your first 10 days of the extended FMLA, just how everything works together. How do they, if you could give us a scenario, I think that might help people see what's been considered and what to expect.
Michelle, did you hear the question?
I did.
Okay.
So for example, let's say we have an employee that got sick over the weekend and has been referred for a COVID test. That employee needs to contact me so that I can do the request form for the emergency paid sick leave. They are entitled to 80 hours of leave with that qualifying condition at 100% of their pay. The 3 that I have of those, I've done those over the phone with the employee and made a note on the form that I did those on the phone and then sent the employee a copy. But that employee would have the emergency paid sick leave available to them for the period they're waiting on their test. Their test result comes back negative, they would return to work on their next scheduled day. If their test is positive, then they would be ordered by a government entity to quarantine, the local health department, and then they would have the remaining of that 80 hours to quarantine. So those are an example of the emergency paid sick leave, how those work. The real important thing and the key is that those employees and department heads funnel them to me so I can provide the form, and then I can alert payroll which employees have those certain pay codes. We are providing individual timesheets to individual employees that have that pay code. So for example, only the 3 people that are right now on approved paid sick leave have the timesheet that has that designation on there. Those employees that are teleworking, we're going to track that. Those employees that are being paid while at home, we're going to track that. So as the policy is finalized tonight by the county commission, those office holders that are currently doing it will be provided a timesheet to track those hours so that we can track them. So for any reimbursement, then also we can see which employees were active at work, which ones were not, and then to ensure that a department head doesn't sign a timesheet saying an employee was at work 40 hours when they weren't physically there for 40 hours. So we've built in all the safeguards that help with timekeeping and payroll standards. But the process is very much just sending them, those employees to me, letting me get them the right form or doing the form with the employee, and then following back up to ensure that it's completed. Then I notify the department, the head with a copy, payroll with a copy, and that's how we're reconciling that. Does that make sense?
Any questions from the office holders on that?
It's me again. Sorry, Felita.
Chief, go ahead.
So, Michelle, does someone who is self-isolated, do they only get the 80-hour period time frame, or do they get to self-isolate until they deem this is safe for them to come back to work? What's that cutoff there? Like, I agree with what Allison was saying. I think that's one of the concerns.
Yeah, I think the committee at the moment in the policy, it says during the COVID-19 pandemic, the committee could certainly make a suggestion for how long a person can self-isolate. It is at the moment, the policy is just written that they can self-isolate till it's declared the pandemic is completed. There's no time frame on there noted, but they could certainly do that if they want to. Right, Allison?
It's right now, there's no limitation on the time period. And I agree with Michelle that is something that the committee could, we can revise to reflect a recommendation, or you can leave it until at the end and then the record would speak for itself as to the timing.
And do
Any
these
recommendations
people,
on time limit on that? It'll be up to the office holders.
and I guess my question too is, do we pay them their sick time, or do we pay them, how are they paid? And if they have no time to use?
This is drafted to under the presumption that they are being paid with the budgeted salary.
Okay, thank you.
Mayor Grandy, correct me if that's incorrect. As the chair of the budget committee, that was our understanding, that this is paid leave that does not tap into an employee's sick time or any other leave.
Yeah, I think that's the intent, yes.
I guess my question is what was just brought up. How long can they do it? So it's till the end of the pandemic, till this is over, or?
Gary, I don't know that this is an exact answer, but as you know, there's an emergency declaration that's been declared by the federal government and for the state government. So at some point, those will end, and maybe that's a point that we could look at as a possibility. I think that's probably worth some discussion.
And I'll direct you, if I may, to, I think we put it in the introductions, that it was not intended to serve as a permanent policy. It's on page 1, final paragraph. And it shall terminate upon the revocation of either the state of Tennessee or the Washington County Declaration, whichever is later. And so that would be the time period.
Okay.
Unless you revise it to say that there's a recommendation that it be capped at a certain number of hours. I would remind you that these self-isolations, if someone has, for example, if they are of a certain age, that's not going to change for them after 80 hours. If they have certain health risks, those will be in effect after 80 hours.
Commissioner Davenport, did you have a question?
No, sir.
Okay. All right.
I will toss out, I talked to a friend of mine that administers HR and benefits in another state. Her company has initiated similar policies that we have. Their self-isolation is a little different than what you have in front of employee morale for employees that may feel like they're treated unfairly because so-and-so may be in that category and they're not, that sort of thing. This friend's company has done self-isolation. They're paying the employee at 2/3 of their regular wage and allowing the employee to use 1/3 of their sick time if they choose to. The only downfall with that is if you have an employee that's at risk, they may continue to still come to work because they don't want to have 2/3 or they don't want to use their sick time and they feel like they can just come to work. So you may be defeating the purpose of having them out of the office to minimize the exposure or the risk by doing that. But I wanted to throw that option out there because I do know one individual company that I've talked to is doing that kind of an option.
Okay, thank you. Right, any other comments this time? We've been presented with an amendment to the Washington County-based personnel policy and employee handbook. Is there a motion on the floor to approve this? It's a motion from Commissioner Davenport. Is there a second?
That was Commissioner Ford.
Oh, Commissioner Ford. I'm sorry, I couldn't hear. Commissioner Ford, is there a second?
I second it.
Second from Commissioner Williams. Okay, further discussion at this time. Okay, I see no other, don't see anybody raised, see no other discussion. Okay, Teresa, would you please call the roll, please? If you could unmute and just, there you go.
Commissioner Davenport,
Yes.
Commissioner Ford, Commissioner McAllister,
Yes.
Commissioner Williams.
Yes.
Okay, 4 yes, 1 absent.
Okay, the motion passes. My understanding is, and Allison, Michelle, correct, this will go, and Mayor, this will go before the full commission tonight at 6. Is that correct?
It is a special call meeting. That's correct. It was noticed yesterday at the request of Chairman Matherly after the meeting on Tuesday. And this was just discussion. For your expectations, it needs to be accepted, approved, and adopted as it is. So it shouldn't be too long of a meeting if anybody wants to tune in for that. But
So
your comments from today, I'll make that one edit to supplement for additional forms.
Okay. So this be presented from this committee at the meeting on that. Okay. All right. Is there anything else to come before this committee? Any essential business this time? Seeing none, is there a motion to adjourn?
So moved.
Commissioner Ford, Commissioner Davenport seconds. All those in favor say yes.
Yes.
They have to do a roll call. Make sure I don't get
Commissioner Davenport,
I think Story wants to hang on a little while. But
They just ask you.
Yes, I approve.
Okay.
Commissioner Ford, Commissioner McAllister,
Yes.
Commissioner Williams.
Yes.
4 yes, 1 absent.
Okay, we are adjourned. Thank you all so much for being here. Thank you for all what you're doing. Thank you. We are adjourned.
Thank you.
Thank you.